What? Let me see. I hope this is not affecting.
Smooth 98.1, love music, love life. That was The Man by Aloe Black. And again, you're welcome to Breakfast in Bed. Just in case you're tuning in for the first time, it's Smooth 98.1, love music, love life. My name is Oluwaseun, and right now it's the Soul Food segment conversation. The topic of our discussion this morning is hearing loss. Hearing loss, and that's what we will be talking about for the next, say, 35 minutes thereabout. Of course, if you have any question, if you have any contribution, something you're not clear about, or a lie that you've been told, you can send your WhatsApp message to 0809-444-0981. Again, 0809-444-0981. And then if you want to call in, the number to dial is 01-448-9981. Again, 01-448-9981. On Twitter, the handle to tag is @Smooth981FM. The hashtag to use is Breakfast in Bed 981. My guest is with me this morning. She's joining me via Zoom, and her name is Dr. Saadat Yahaya. She is a consultant ENT specialist. That's ear, nose, and throat specialist. Good morning. Good morning, ma'am.
Good morning.
Thank you so much for joining me this morning. I do appreciate it. And, taking you through all the process of getting ready. Thank you so much. By the way, we're streaming live on YouTube, just in case you want to catch our faces. Go to YouTube and search for @Smooth981, or rather just search for Smooth981, and you definitely will see us there. Now, I already see the phone line buzzing. I'm not sure what you want to say, yes, but please calm down. At least let us make an introduction, and then you can call back. Thank you so much. Now let's get into the mix. So today we're talking about hearing loss. I have said that so many times. In fact, I have told people who have generator noises surrounding them, people who constantly use earpiece and a lot of that to come through. So let's get to the basics. Now, if I define hearing loss to be the loss of hearing in one of your ears, or maybe another, say it could be a partial one, it could be a full one. Would I be right to describe it that way?
Yes, miss. You are right.
But is there more to it, or that's just the definition?
Being that we're on a show like this, for people that it's only medical people that you understand our terminologies. So it's better to just be simple that when you say hearing loss is impairment in hearing. Of course, now, there are degrees of hearing, what are the type of hearing, management, when to run to the hospital, or when not to be worried. So we have to talk about all that first. So it's not just a simple saying, yes, I'm not hearing, but there's more to it.
All right, then. So let's get into it. So what are the types of hearing loss? Before we go to even the symptoms, let's even know the type so that we are able to separate it.
Okay, the type of hearing loss we have conductive hearing loss. And that's when you have anything that is interfering with sound passage from the external ear to the middle ear and then to the inner ear. Then we have the sensorineural hearing loss. And that's when these are caused by damages to the nerves and then the inner nerves, because the ear is actually divided into three parts. We have the external, that's from the outside to the drum, the ear drum, and then from the ear drum we have the middle ear. That's where we have the bony ossicles, and then we now have the inner ear. That's where we have the nerves, the 8 nerves, and all other things. So it's now anything interfering now with those 3 parts of the ear.
Okay.
To the middle ear causes conductive hearing loss. That's anything interfering, foreign body, wax. You call that, that will give you a conductive hearing loss. But when it's not interfering in the inner ear, that's where we have that, like we call it like the engine house. That's where we have the nerves, you have the cochlea. That's anything interfering with that place is now this could now cause sensorineural hearing loss. And at times you could have mixed, having both conductive and sensorineural hearing loss.
Okay, so established, we have the conductive, we have the sensorineural, and then we have the mixed one. So the mixed one being the one that can be like rice and beans, combining sensorineural and the conductive. All right, so let's go back to the conductive, the way you broke it down. What are the causes?
Okay, for conductive hearing loss, it could actually be a congenital thing. That means the patient was born with it. At the same time, we have the acquired causes, which are the commoner ones. So for the congenital hearing loss, now, first for a child, maybe at birth, during development, some things actually, some things go wrong, where you have the opening being stenosed, or there's even no opening of the hair canal at all. Do you understand? Or you have these middle hair bones, they are fused together, we call them fixation of the stapes bones. That, of course, will interfere with any passage of hair because it's the bones that pull on the drum that actually send the sound waves to the inner ear. So if you don't have any fixation there or any damage or any congenital anomaly there, that is actually going to give you a problem. Or we have those ossicles that could be broken. We call it ossicular dissociation. That, of course, is going to interfere with passage of sound wave. So that, of course, can actually be caused. And then some people have called it as a mass cholestatoma, which is just like a growth in the middle here. That is actually going to cause interference in passage of air. And those are just like the congenital, and so they will have other one. They also, you now have the acquired ones. Of course, as simple as wax impaction. That's one of the commonest we have around. People have wax in both ears. And of course, that's anything that says going to interfere passage of sound. Because the drum will not be able to do its function. The middle ear bones, ossicles will not be able to do its function. And then that will interfere with hearing. And of course, if you have boil in the hair, you have infections, you understand? Or you have a perforated drum from maybe trauma, somebody slaps someone, and then the drum is perforated. It's actually going to actually interfere with passage, and that will give you a conductive hearing loss. Then some that have infection, when they have middle ear infection, of course, that's going to have, when you have fluid at the back of the middle ear, that's actually going to interfere with passage of sound wave. So that is actually going to give that person, oh, I have otitis media. That's one of the commonest things too that can actually interfere. But now you have secretion, you have pus there and all that. That's going to dampen the sound. And then the hearing loss, you have hearing loss at that time. Or some people have some masses in the middle here. It's a tiny space. Imagine now a growth there. It do occur, it could be malignant, it could be benign. That will dampen the sound and also give you a conductive hearing loss. Of course, when you have trauma, RTA, or those that have chronic suppurative otitis media, that's pus there.
Oh, well, those terms now are becoming really, really too big for me to break down. Okay, so.
Okay, I'm with you.
Yeah. I wanted you to break down those terms, as you're dishing them out, they're so big. So if there is a possible way that you can just bring it down to smaller terms, at least two very interesting things that I know we will definitely go back to after we take a break is the wax impaction. Because the truth is, many times we've been told that we should not take out wax, especially with the use of cotton bud from our ears. So that's one. And another one is the fact that if you slap somebody, the person can actually have a temporary or whatever hearing loss. So that's also another one that we will be coming back to. But in the meantime, let's quickly take a quick break. So when we come back, we'll be breaking down all the big words, and you'll be faced with the reality and the everyday activities of yours that actually can bring about hearing loss. This is still Smooth 98.1. Yeah, you should get ready your questions. All those big grammars, I'm like, wait, what? The ossicular, the this, the that. I'm just considering. So I can understand, but then I'm looking at the average listener, if they're able to comprehend it.
Sharp deposits, ability to sell slips, bet insurance, and more. Waiting the Totori body pass, we say you feel make money from things like virtual games, basketball, horse racing, and many more. Just log on to onexbet.ng to register, and make you not forget to use the promo code RadioWin to get 200% bonus on top your first deposit on OneXBet. Bets for every taste.
Come lunchtime on Smooth 98.1, we serve you world music. Travel Africa and the rest of the world as we bring you the smoothest collections of traditional rhythm. It's a rich blend of strings, percussions, wind instruments, and voices. Indulge yourself and go beyond the music.
The greatest activity in music happened during the apartheid era, and great musicians came out of that era.
Discover unique sounds of places, people, and culture, and come alive in your soul. It's a taste of the world on the
Smooth 98.1, love music, love life. Right now, the show is Breakfast in Bed. The segment is Soul Food Conversation. And the topic of conversation is hearing loss. Of course, I already said that if you have questions or something you're not clear about, the number to call is 01-448-9981. And the number to send your WhatsApp messages to is 0809-444-0981. My guest is Dr. Saadat Yahaya, and she's a consultant ENT surgeon, ENT standing for ear, nose, and throat. Now, before I interrupted you, before we went on the break, you were giving me some of the possible causes of conductive hearing loss. And of course, I said we'll go back to the wax impaction and, how slap can cause hearing loss. But please let me allow you go back to some of the other causes of conductive hearing loss.
Okay, I actually stopped where I said it. I said the ossicles are like those tiny bones. Then the middle, those are what's in there. So anything that will cause a disruption, a break, a disease, of course, is going to interfere with the passage of sound wave, and that will actually give you a reduced hearing, which of course will term as hearing loss. Okay, all right. So now is a good time to go back to that wax. So wax, as we've been told, is very important for the ears because it helps you to trap. I'm bringing down some of the myths now, some of the things that we've heard. So it is said that wax in your ear helps you to trap the unnecessary foreign bodies that may want to fly into your ears, and then it holds it so that it does not gain direct access into your inner ear. First, is that true? Yes, yes. Okay, and then another one is that being reluctant is because it's only when the eardrum is broken, that's when they gain access. The hair would entering to get into the external hair. There's a drum that seals the middle hair and then the inner hair. So it's only when now the eardrum is broken, that's when it gets access into the inner hair, from the middle hair to the inner hair. Thank you. Okay, thank you very much for that clarification. So another thing is that you should not remove the wax in your ear using cotton bud. Yes. Why? Okay. The wax are just like the body soaks them to clean the hair and then takes it back, as in absorb it back where it came from. Because if you look at the anatomy of the hair, you will just see at the entrance, there are hair strands. That area is where it's dissipated. And so far as in that particular area, the body takes it back, cleanse everywhere, and then it absorbs it back to where it's coming from. But when you clean, what you do is you're actually pushing it beyond where the hair strands are. And at that time, that particular part of the hair doesn't know what to do with it. And then over time, as you clean, because we're doing it blindly, you keep piling up. And then what it now does is, since the eardrum is just directly behind, it now blocks the eardrum. And then, of course, there's interference of sound wave. So that you have to automatically, gradually develop hearing loss. And when the whole place is filled up, or at times it doesn't even have to fill up, you just have, you're unable to hear again. So you're just supposed to leave the body, cleanse it, take it back where it comes from, and that is it. You're not supposed to wash your hair. You're not supposed to clean it with cotton bud. Yes, at times someone will say, "Oh, it's itching me." I just tell them, take your cleaner and just clean the house. I mean, there's this outside, we call it tragal area. I just kind of rub the place. At times you have allergy, which can make someone itch. So that doesn't mean you have to clean the hair. So you should just leave it alone. It's the body's work to actually do his own work by taking it back. People that clean more are the ones that the wax produce more, and then later they it again. We just leave it for that person, and then it keeps piling up, and then that's when problem starts. So you're not supposed to. Yeah. The more you clean, the more the body produces for you, and then it hands off cleaning. cleaned out, and then the body says, oh, this person is not disturbing me again. Let me do my work, which may not be immediate at times.
That's very interesting. Thank you. So, because I was going to ask you the possible reasons why we may have an over secretion of the earwax. So, aside, the person cleaning it, taking it out using a cotton bud or whatever means that the person has deemed fit, is there another reason why the ear will over secrete wax?
Some people have that. I would say some people have production of wax. There are some conditions, as in they just produce wax. That's the way they are. Maybe you have pathology and the hair is just producing. So there are conditions where a patient will just be producing wax. It's like more of like they just produce more. Not even because, but the kind of hair they have produces more wax than others. So there are some conditions like that.
So in a condition like that, what should the person do?
It should just more of like maybe you see us more often. So us ENT more often. So at least we watch it and see, you understand. Because every time, because of the location of the hair strand, is almost at the outer parts. So a lot of people say, oh, my hair is dirty. It's not, because it's just, you can just see it. The inner part most time is clean. But just because the hair strands are on the outer part, most time you look, I show to my patient when they come. I said, can you see? Maybe they bring the spouse or the children. I said, come and see. There's nothing inside this hair. So what are you cleaning? And then at the same time, when you are cleaning, what you are doing is you're actually even causing more harm than good to the hair, because you're using cotton bud. You're more of like bruising the floor. And I ask most people, do you wash your hand before cleaning? They tell me, no, why till I wash my hand? At the same time, you are introducing infection into the hair by trying to enjoy cotton bud. So I ask them, almost 99% will tell you, oh, I don't wash my hand. Some just take anything, broom, feathers, cover of biro, and they're just enjoying the thing. So actually, they're even causing more harm. At the same time, you can even perforate the drum. We've seen a lot of kids that their drum have been perforated from cleaning because they don't know how far they should go. Or some slip off. Or there's an accident, someone is just running around and just pushing the cotton bud, and then it perforates the drum or cause some trauma into the hair. So it's actually not a good thing cleaning the hair drum. Just leave it. The body will do its work.
Oh, now I chuckled while you were saying something about feather cover of virus, because I know I have seen many of those videos and even memes where somebody is cleaning or tickling their drums with a feather or the cover of the barrel, and then there is that feeling it produces, and people here said it is very, very good for them. So I'm very glad that you just laid everything to rest, because even if this is the only thing we're able to touch this morning, I feel it is a success already, because a lot of people need to know this. Cisco Delgado says, Oluwaseun, are you saying that we shouldn't clean our ears with cotton buds? Yes, that's what you just heard. Because take, for instance, after my haircut and shower, I noticed that tiny hair follicles come into my ears. And I have seen people where their ears are blocked with earwax and they undergo surgery to remove it. Is it not better to clean to avoid such? Well, I hope that you've gotten the explanation. Is there something you want to add to that?
Yes, we don't have to do surgery to clean earwax. You just walk in to an ENT person, they will look at it for you. And if there's a need, because it's not every wax you need to remove, it acts as a protective boundary for you. You said maybe dust or some insect trying to fly in. We don't even do surgery to do, we just clean it out. And it's not even all. If it's not much, you say, don't worry, you can just go with it. But because you are seeing it, because of the location of the ear, so you think it's so much inside. Why is actually not even, no, it's not nothing to worry about. We don't do surgeries. If it's so much that is obstructing and causing hearing loss, we just wash it out, or we suck it out, or we clean it. So there are different approaches of cleaning wax out. That's if need be, but it's not all wax that you take out.
Thank you so much for that one. Thank you, and thank you again. So now you hygiene policies. Yeah, I decided to put S at the back so that whenever you're looking at people and you're looking inside their ear and you're saying, oh, yeah, your ear is dirty, you know that the ear is self-cleaning, and what you're seeing is not exactly the reflection of what is going on the inside. So maybe you can just, I'm guessing you can use your damp towel just to clean the outer part, right? So that's good enough.
Yes.
All right.
And some wash their hair, soap and water. I said, please don't do that. If you feel, just clean the outer part and that's all. With a clean towel, nothing more, if you have to. Because the way the hair drum is, it slopes downward. So nothing can actually even, like the water go in unless you pour water in. It slopes. That's why when you even put hair drop, it drops out.
Mm.
So when you say you're bathing, and unless you actually put the water and some are washing, it will actually not go in. So just clean the outside and that's fine.
All right, thank you. While you were saying something now, I got curious. You know, those times when we go to swim or then we dip our head inside water and the water rushes into our ears. And it's almost like in that moment, we have that temporary imbalance. So what happens then? And what happens if the water stays in for too long?
It's actually because you're in water. If you come out, it drops out. Or just bend the hair, it will come out. Because of the shape, nothing can stay inside. Unless you maybe like you put foreign body there intentionally. But when it's water, it pours out. Of course, when you're in water, it's just like you're soaking every part of your body in water. And that's why I think people use ear muffs to block the hair now. But if you're not doing that, I mean, you're underwater and everything is going to go to wherever space that is available. When you come out, it will drain out. And for most people just bend their head, maybe to the side or where and the thing just sip out. You don't have to do anything unless there's a perforation. And we advise anyone with perforation, hair drum perforation, not to swim. Because what you are doing is your passage is just straight. You're just transmitting everything from the external hair to the middle hair. And then that's how infection spreads.
And of course, you wouldn't know that you have an ear perforation if you do not go to see a specialist, which is one of the reasons you need to see your specialist, and ENT specifically. Of course, I'm guessing if you go to a general practitioner, you'll be referred to an ENT specialist. Thank you again so much for that one. So now we've talked about conductive. Let's go to sensorineural, right?
Yes.
Yeah. So what are the causes and how does it present itself?
Okay. Of course, I actually told you, I said there's the external hair, there's a middle hair. Sensorineural is anything in the inner hair. And that's where they put the engine house, where you have the cochlea and then the nerves there. So anything that causes any damage to that particular inner hair will give you sensorineural hearing loss. Of course, that can also be congenital too, and we have acquired causes. Of course, congenital causes, most times will show at birth. But at times we have some delayed sensorineural hearing loss that wouldn't show at birth, will actually show maybe later in life, okay? And then at the same time, we also have the acquired ones. Of course, we have infections of the labyrinth. Labyrinth, there is an organ in the inner hair, and that's the one that normally gives us dizziness. So any infection spreading there could be viral, it could be bacteria, or even probably some organ, maybe from syphilis. If it affects that labyrinth, is actually going to give you sensorineural hearing loss. And of course, our popular trauma, slap, fractures, because when you give some, we call it dirty slap. It can cause harm. We call it dirty slap. That's why I don't dirty slap. Of course, those that have road traffic accident, because at the same time, they actually fracture that particular area, and that can actually get to the labyrinth, okay? Because by the time someone have a RTA, most people have head injuries. It fractures their temporal bone, or maybe we have a concussion and all that. It can actually infect that one. And when you get infected, of course, patients are feeling dizzy, they start having noise in the hair. That's a problem. Or even when we do some of our hair surgeries, of course, now we're very careful. That, of course, is written that can actually cause that infection of the labyrinth. And of course, noise-induced hearing loss, which is very 90% of adults. That's one of the problems that causes hearing loss because of our occupational hazard, the cosmopolitan area of Lagos, loud earpiece, earbuds, and all that. That, of course, can give you noise-induced hearing loss. And then, of course, use of drugs anyhow. I tell people, the way I ask is, how many times have you treated malaria this year? You say, I just go to the pharmacy. I think I've taken it like 10 times. Those are people using drugs, because the so-called even drugs were taken. Chloroquine, anti-malarials, diuretics, even some antihypertensives, because it's not everything that is drug that is normal. It could be something you're using for your own health, but of course, it has toxicity to the hair. All those gentamicin, chloramphenicol, we should run away from those drugs. Even erythromycin, NSAIDs, ibuprofen, diclofenac, we should run away from all, because excessive use of them can give you problem to the hair, okay? So we have to be careful, because all the presbyocusis, that's what we call it, aging process, that can give you sensorineural hearing loss. Then, of course, Meniere's disease. Of course, that's some people who come with dizzy spell, with noise in the hair, and we call it fullness in the hair. We diagnose that as Meniere's disease. It's everything that has to do with the inner ear. And of course, you could have some tumors, masses there, some, and then some, I say it's hereditary. You could actually, then some condition of course can tip someone to have sensory hearing loss, diabetes, multiple sclerosis, blood dyscrasias, things like that can actually tip you to have sensory hearing loss. I hope I'm not boring you.
No, you're not. I am just picturing how everything seems to be very interconnected, especially when you were talking about all those drugs.
Yes.
Wow. So now let's go back to the... No, go ahead.
Okay. So people that have pain, I'm taking that, don't even alcohol, tobacco, marijuana, they can damage the inner ear. Propranolol, ampicillin, drugs that people just go to the pharmacy to go and get. You have to be careful. It's only when prescribed. And of course, you have maybe for 5 days, for 1 week, you stop. But excessive use, prolonged use of those can actually cause damage to the inner ear. So we should be careful. Of course, maybe some people on cancer drugs, cisplatin and all that, can actually have issues, and that will cause the sensorineural hearing loss.
Interesting. Somebody is listening to this now and the person is saying, oh, well, I take these drugs on a regular when I feel like I just walk into the pharmacy, or I even have this thing in my bathroom shelf and nothing is happening to me. Now, let's talk about the mechanism of gradual hearing loss. Of course, we'll go back to the noise induced, which I'm very much interested in. But how does hearing loss happen over time? Because I am sure people who are abusing those drugs, who are taking tobacco anyhow, alcohol, all those things, I'm sure they probably are not, in quotes, deaf yet. So how does this thing happen?
The issue of this noise-induced hearing loss is more of like a thing that it actually goes, there's what they call, you have the permanent one and then you have the temporary one. So the hearing loss of the temporary one, you have maybe an impairment that is immediate after exposure to loud noise, but will recover over some few minutes or few hours. But some are permanent, that the hearing loss is just permanent and does not recover at all. And that will determine, is actually determined by 5 factors. One, what's the frequency of the noise the person is hearing? Is it very loud noise? Anything that you're having, like maybe 2000 hertz, will give you more of like a damage, will affect the air frequency. So the frequency of that sound, then the intensity of that sound, and the duration of the noise. So it's not like you are exposed to that noise every day. It's like the person is looking for and it's a very loud sound. So I said the frequency, the intensity, and the duration of that sound. Then, of course, continuous noise, when it's not continuous, is harmful. At the same time, if, for example, this one is already susceptible to having maybe something, like I said, maybe congenital cause underlying their cause. So with now the exposure of this noise, they are more at risk. And then at the same time, some have maybe pre-existing ear diseases. So everything just, all these factors just work together, and then that give you that particular noise-induced hearing loss. So the more you're exposed, the intensity of the sound you're hearing, the duration that is taken for maybe like you are there every 10 hours every day, your profession too, So we advise, of course, you don't use, we ask you to use the earmuffs at not too loud. And of course, you can reduce the frequency of using this. I tell people to don't use earpiece. From one of our studies, WHO study says you're allowed to only use earpiece for more than 60 minutes in 24 hours. Meaning it's just like driving or have to quickly pick a call for no more than 60 minutes in 24 hours. That's the WHO standard of you if you want to use earpiece. So anything beyond, then the person is doing harm to the hair.
You should see my face right now. I am so concerned because I know I use earpiece for a long time in a day, and I am not alone in this. Earpiece, big headset, it sounds as sweeter and better when they're loud, and the bass is just, or the bass rather, is just booming and everything. And not even earpiece alone. We're talking about the speakers, you're increasing them and everywhere is vibrating. The music is just better that way. And
yes.
It's the noise and the sounds are everywhere in Lagos. You're talking about the churches, you're talking about the mosque, you're talking about the bars that are close to your house, you're talking about the ones coming from cars. It's everywhere. You almost cannot avoid it. So what can an average Lagosian do to insulate themselves from this?
You have to, as much as possible, stay away. And one thing about sensorineural hearing loss is early detection. I advise people like you, people that are always having contact, they should actually have an early hearing assessment. So you have a baseline. So by the time you have an early detection, of course, you can stop the progression or reverse it, or the person start an early rehabilitation program. That would, of course, for communication. So by the time early detection, by doing those ear tests, of course, like with pre-employment screening for everyone, then maybe every 6 months, every 1 year, everybody goes for it. So by the time you're already, okay, I start with a normal hearing, and then in 6 months, I'm already having it, and I know that the problem is starting. So it's either you now change the thing, or you start using hair muffs, reduce what you are doing. I mean, the sound, the frequency, the intensity of that thing. And then, of course, we advise maybe people that are exposed to, they have to wear hair muffs. Even though that means if you're wearing hair muffs, you won't be walking around with hair muffs. Because if there's a sound from a trailer or your car coming, you can hit that person. So that means you stay away from those sounds as much as possible. Because prevention is always better than cure. That's the way it is. Yes. So if you're able to pick it early, okay, you have to stop doing what you're doing wrong, that you're doing wrong. And then some of community have to start using hearing aid, because by the time the hair is strong, you can only stop some. At times, like I said, there's a permanent and the temporary one. Before it becomes permanent, that there's nothing you can do. But it's difficult, those nerves don't really recover well. So it's better to prevent. So I won't say stay at home. If, of course, by the time you have good hearing, don't abuse your hearing by being exposed to loud sound and staying in loud areas. I told you when they go to church, of course, don't stay near speaker. Stay away from the thing. But for the speaker should actually not even be facing, the audience, or maybe the sound should not be that loud. But see, when anyone's staying is at risk to all this problem. And of course, those are maybe exposed to sound, loud sound every day. But they should have some protective things that they give them at work, and then regular hearing assessment, so as to be able to detect early hearing loss.
When you talked about the ones, you want to say something?
No, issue of drugs. Don't just go buying drugs. Don't abuse medication. I'll let them prescribe that you have this particular thing, and then they give you medication to use, because it's not every fever or body pain that is malaria. At least let them just go and keep buying them. Hey, I've forgotten to all these pain, alabukun, all those things. I do want my please don't take them, because you don't know the concentration, you don't know what quantity you are taking. They can destroy the hair. And of course, you have to be careful. Some drugs you take, like quinine, especially now with COVID, it will knock out the hair in that instant, and the person is dead for life. Chloramphenicol. So people should be very careful. That one you will know is a permanent loss immediately. I've seen kids in hospital, you give some drug when they have maybe meningitis you're treating, and the child that is looking at you next day is deaf. So we all have to be careful what we take, and don't go to where it's noisy. As much as I can't say stay in your house.
This is knocking me off, literally, because there is a lot coming out and I'm like, okay, so where do we run to? And the fact that everything is totally interconnected looks like we have to be very, very careful. I have a message from Mojisola. She says, good morning, Sheung. Thanks for this very important topic in hearing loss. Please, I use earpiece, and when I do, I use only one at a time, and the volume is such that I hear everything anyone says around me, except I'm fully concentrated on the program. Is there still any harm in that?
Yes, you are insulting that particular hair you're using it with.
Wow.
But it is actually, I don't know what she meant by she could hear everybody around. I don't know what, of course, you should know that you should not put that in very loud. Because some of the earpieces, they are very high tech. So you can pick anything around you. So I don't know what's the volume of the noise. So far it's not above normal. No, it's not at high tone. Of course, she can do that, but what she's doing is let her have a regular hair check. And if does she have to use that earpiece? Can't she use maybe a speaker of her phone? Because like I said, no more than 60 minutes in 24 hours at a subnormal tone. So if we're thinking of that, because she may not have anything now, but the more, I said, the frequency, the intensity, the longer time she's using, she finds that hair may have problem, and then the other one will be fine. I don't know if that answers my question.
Yeah, I am guessing it does. To a large extent, I feel like everybody who's listening to me is very guilty of listening to anything using the earpiece for more than 60 minutes or using in high volumes. I just know, because these days, even on the roads, you see everybody using earpiece because we don't want to disturb others. And then, there's just that feel that comes with using your earpiece. But right now, we'll take a quick break. Let's just all calm down. If you're using your earpiece, please unplug right now so that you can use the speaker of your phone. And then if you're listening in your car, that's better for you. If the volumes were very high before, please turn it down. And of course, if you want to call in to just table your question or anything, make sure you turn off your radio too. This is still Smooth 98.1. We'll take a break. When we come back, we'll still be talking about the topic of hearing loss. And I have my guest here with me, Dr. Saadat Yahaya. She's a consultant ENT surgeon. Oh, this is scary. Oh my God.
Wow.
I'm scared. There are times I sleep with my headset, the big one. And of course, there are times I wake up with sharp. I'll be asking you that one. There are times I wake up with sharp pain in my ears, so that'll be the next one. And of course, the ringing, the tinnitus or the tinnitus, that one that we. Some people say, they're calling me from my village.
Or just and then she doesn't have time to and that is it. And that is very, very difficult to do. That and more.
Profit us back for you to take care of your daily experiences.
Don't have to be careful when you access
your business and how to get you to the next level. If you do
now I understand better why you're not using your earpiece or your headset, because I would have said you should.
Or even I reduce the volume and then just put the phone to my ears. So it's only me that is there.
Wow. Wow. This is, oh my God.
A critical look at your lifestyle and the state.
I definitely need to make some adjustments.
Yes.
Life in a city that
I can't hear you well. I think it's a bit muffled.
They are legislating in Lagos.
Is that true?
There are laws in Lagos about noise. The particular noise level.
Relevant information.
Studio now touching that
connection.
It'll come in.
The Smooth Health every Thursday.
Smooth 98.1. Love music, love life. Right now it's breakfast in bed, and the topic of conversation is hearing loss. Now, if you're joining me on YouTube, you'll see the way I have been shifting and turning in my seat and screaming because of all these revelations that I just got. The funny thing, when Dr. Saadat, my guest this morning, joined me via Zoom call this morning, I wanted to tell her, please use your headset or your earpiece for better hearing. And now it just all makes sense that's one of the reasons that she's not using it. So she's currently using a speaker. So the point of all this is that when we're done, please make adjustments. Make lots of adjustments so that the way it is said that prevention is better than cure. That literally is the situation. So that in some years' time, it looks like everything is fine right now, but in some years' time, now things might not be the same. And that brings me to it. So I did say that many times I've been guilty of using my headset for a long time. And sometimes there have been few times that I went to bed, slept off with them, and I wake up with this pain, this sharp pain in my ears. So what is that one?
The thing is, the hair is actually made up of mostly cartilage, and then the skin is more adherent to it. So that means you're actually compressing it. And when you're compressing it, you're actually reducing blood supply to your hair. And something you have, tightened up with whatever, you actually react. Because when you compress the blood supply, you have pains, you have inflammation, which comes with pain. Okay? And what you're actually doing is you find out your hairs will be hot. Because the skins are hot. So we are more of like inflicting heat. That hair with the hair that is already impairing the blood supply. So like those are signs of inflammation. And with time over time, that inflammation can actually lead to infection. And then you have cauliflower hair. And also, I tell some patients, heat generates a lot of fungal infection because this COVID period, we actually had a lot of fungal infection because when you have heat, humid environment, it encourages the growth of fungi. It's not that when you put bread, put it down in a hot place, you see that mold on it. We saw a lot of patients with mold in the hair because what you are doing is you are just sealing up any hair escaping out. So you're putting all sound directly into your hair. There's heat, there's lots of blood supply. And then over time, the patients are having infection. Of course, fungi can go in, bacterial superimpose will go in. And then what you are doing, even if the sound is so loud, can actually even break your ossicles because the hair drum, the way sound goes, it goes directly from outside into the vibrate the hair drum. And those bones are actually attached to the hair drum. So when you move them, it's like you're overstimulating them. The bones can actually fracture. And then sending signal to the inner hair. So it's like, it's a continuum. Everything you're doing is actually, as I'm speaking to you now, some sound are actually dispersing, but now you are concentrating everything into the hair. And of course, it's going into the inner hair. So it's like you're causing trouble for that whole place. So it's not even nice. When I even say 60 minutes, you won't sleep with the earpiece or even with the mold, And then, of course, when you do that, the sound is just directed into the hair. So you should actually do that. And of course, you can actually have noise because one of the complaints of hearing loss, some has having tinnitus. Some tinnitus are treatable if you know the cause, and some are untreatable, and patient has to live with it for life. So it's better than having noise in the hair because that's what you're doing. You're sending everything directly into the hair, down the pathway from the external hair, the middle hair, and then the inner hair. Because the drum has to vibrate, unless when the drum is broken, then it now passes through the bone. Do you understand? But even it has to go through that same hair drum, vibrate the drum, the bones are attached to it, and then now open the stapes, enter into the middle hair. So.
Whoa. Well, by the way, tinnitus has to do with that ringing in your ears. The one that whenever it happens to you or it comes on suddenly, you think it's your village people that are calling you from the village, which is a common one. And then people begin to just pray and rebuke. Yeah, so that is tinnitus. So anytime you get that, that is already a warning signal, I suppose.
Yes, and it's not even, or most time it's all ringing. At time it's tapping, at time it's like your pulse rate, because it could be a tumor. At times it's humming, or like, so there are different sounds. So it's not just ringing. Also, the also ringing. There are different type of sounds that and each one means different types of problem.
So it all
yeah. Sorry?
Yeah, so I was going to say it all boils down to the fact that you need to keep your doctor as your friend and always go for regular checkups.
Yes, and then something important came to mind is anytime you start any medication and you start having any effect in the hair, you stop that medication. Don't complete it. Just go and complete.
I didn't hear what you said last.
Oh.
Can you hear me?
Did you hear me?
Yeah, what you said last.
Yes, I can hear you.
You were saying something about medications.
Yes, any medication maybe you commence a medication and you start having some, whatever effect in the hair, please just stop using that drug and complain. Maybe to the doctor that gave it. I start having some effect or whatever effect, because it's easier to quickly reverse than it knocking out the hair. So just go back to the doctor. So I started using drugs, I started having some maybe sound or some whatever in the hair, and then I stopped the drug. So let them give you another one. It may be a warning sign. So don't wait until you have come. Most people come, I will not have. I was taking anti-malaria. At that time I started having some, but I completed the drug. It may have knocked out the hearing. But because the other one is working, you won't even know. Is that maybe when you turn that hair to that particular side, like, why am I not hearing it? Then you start turning. But most people are not even vigilant because the other hair will work for you, the normal hair. So you won't even know that one hair is maybe having a problem. Until maybe when I use the phone, now he's more food on this hair, I'm not hearing. Of course, maybe too late by then.
Well, last one.
I tell people again, go and check the cotton board you're using. You never see it for cleaning hair as one of the indication. So you can't hold anyone liable. Check the cotton board.
That's interesting. So yes, I said my last question will be this one, or at least the second to the last. There are times when people are talking to you and they are shouting. They do not know that you're shouting, but people around them are telling you, you're shouting, I am right in front of you. Is that an indication of gradual hearing loss?
Is an indication of hearing loss. Just let them see ENT. Because at times may just wax, blocking both ears. And that's conductive hearing loss. So they'll just be shouting at the loudest of their voice. It's because they cannot hear. It may just be wax. So of course, the ENT surgeon. So of course, you can actually check for you and see what the problem is. Of course, so by the time you are now checking and you're not seeing any wax, then of course, you know, it's actually now the middle here, or you check for that. Of course, investigations have to come in. So to know what type of, what kind of hearing loss the patient is having.
Well, on that note, a special shout out to all Lagosians who are always shouting on top of their voices. Please, you should go see your specialist because it's a common thing around here. I remember one of the callers last week who called in, and when we were talking about Lagos State and, you know, the experiences, he said he traveled to Osun State and, you know, he was on the phone. And when he was done making that call, somebody came around and said, brother, excuse me, please, are you from Lagos? He said, yes. Why? He said, because when you were on the phone, you were shouting. I could not get that one out of my head because that's the truth. A lot of Lagosians are shouting and they do not know. So please go visit the specialist, go visit the doctor. On that note, what would be your general word of advice, prevention tips to people?
Like I said, early detection is key. Earpiece, please don't use earpiece if you don't have to. Drugs, not just buying any drug, using any drug, unprescribed drugs, you know? And regularly, of course, just visit the ENT, let them look into your ears. It's not just all visit has to do that. Maybe you have to wash. Do you understand? Okay, let them just look. If you have any complaint, you come to us. We're your friends. We're not your enemy. You know, we look at you, advise you. Of course, you can be open with us to tell, okay, I'm doing this, so don't do that again. And of course, those with diabetes, hypertension, please also visit your doctors. They worsen your hearing, especially diabetes. It destroys all the nerve endings. So please make sure you take your drugs regularly. Oh, they say I'm diabetic. Please make sure you visit your doctors so that all these things are actually picked early. Mostly it's just like early detection is key.
Thank you.
Like, visit ENT specialists. Let us do our work. Let us serve you better.
So if people want to visit you, how can they do that?
You can always, I always say I give them my number. I'm not running away. So they can always number. And then, of course, when they call, we fix an appointment and then we'll see.
Okay. Your people can access you on the Doctora platform, I believe.
Yes, please. All
right. So the Doctora platform is, how can they do that? You know, for the regular, I know it, but then for the regular person who's not aware of it.
Actually, just go online and actually, I actually want to maybe book an appointment to see an ENT surgeon, and then they can always find me. And I'm also, as I own a Buena Salud clinic. If you go online, you're going to see my clinic there. You can always see the phone numbers there and then communicate with us. Buena Salud clinic. And then doctor, there you get it there. And the informations are there.
Thank you so much. I really, really appreciate you for this wealth of knowledge that you shared with us. Thank you. I mean, I can't even overstate it. I really, really appreciate it. Thank you. So if you want to reach out to her, she's Dr. Saadat Yahaya. You can reach out to her on the Doctora platform. Just go online and search for www.doctora.com. And then you can look for her at Buena Salud Clinic. And then she will attend to you because, as she has rightly said, prevention is very, very effective and early detection is very key. So on that note, we'll round off the segment and then we'll be back in the 9 o'clock hour to take the Smooth Explorer. My guest this morning is the legendary, beautiful Nubia. So you definitely don't want to miss that conversation. I'll be looking forward to it. Again, thank you, Dr. Saadat. It's a pleasure having you this morning.
Thank you so much. Bye.
Bye. And by the way, if you have missed this conversation, it's on YouTube, so you can go back for a replay, search for Smooth 91 on YouTube, and then it will be right there so that you can catch up with this conversation and then share it to your family and friends so that, together you can hear each other and share the love and spread the love. Stay with us in the 9 o'clock time or hour. We will be back with the Smooth Explorer segment.
Jessica Bowles. When I think of music, I think of a safe place. I think of comfort. Music to me is therapy. Music heals my soul. Music makes my day
Thank you,
better.
people. I appreciate it.
Music to me is everything.